Hi, my name is Natalie Villanueva, and I will be talking about antihypertensive drugs, which are prescription drugs. So, antihypertensive drugs treat high blood pressure. Their goal is to keep the heart strong, prevent heart failure, a heart attack, kidney failure, or a stroke. High blood pressure makes your heart's job more difficult and more demanding. So, bringing your blood pressure down makes it easier for your heart to keep pumping blood to your essential organs and cells 24 hours a day. Antihypertensives bring down blood pressure in various ways. Some widen your blood vessels to help blood flow, and some help remove extra fluids from your blood. Most people take these in the form of a pill, but some can be put through an IV depending on your doctor. A little about the history of antihypertensive agents. In the early 1900s, non-pharmacological methods to treat hypertension included strict sodium restriction, while others included injections of pyrogens and surgical methods. And sodium thiocyanate was the first chemical used for hypertension. In the 1950s, hypertension management became more widely practiced, and British physician James Black developed beta blockers in 1960. This led to the development of calcium blockers, which then led to angio-converting enzyme inhibitors, to angiotensin receptor blockers, and then renin inhibitors. We now have a powerful system to treat all forms of hypertension today. Effects. There are different types of antihypertensive agents. The ones that are mainly used to treat hypertension are diuretics, beta blockers, angiotensin converting enzyme inhibitors, angiotensin II receptors, and calcium channel blockers. They all affect the body in different ways. Diuretics help your kidneys remove sodium from your body so your blood vessels don't have to hold in as much fluid and your blood pressure goes down. Beta blockers make the heart beat at a slower rate and with less force. ACE inhibitors reduce the production of angiotensin II in your body. This helps relax your blood vessels, which lowers your blood pressure. ARBs reduce the action of angiotensin II in your body. And like ACE inhibitors, it helps relax your blood vessels, which lowers your blood pressure. Calcium channel blockers relaxes blood vessels by reducing calcium entering cells in the walls of the blood vessel. Side effects. Antihypertensive drugs have many side effects that include coughing, diarrhea, or constipation, dizziness or lightheadedness, erection problems, feeling nervous, having fatigue, headaches, nausea, vomiting, skin rash, and weight loss or gain without even trying. They can also affect the brain. A research team discovered that they increase the effects of opioids that the brain naturally produces. This can fine-tune the function of a specific brain circuit. The study focused on angiotensin-converting enzymes, which has long been known to regulate blood pressure, and it is a safe class of drugs used to control blood pressure. ACE inhibitors have the potential to be redesigned to treat brain conditions. Some risks include injuries, changes in electrolyte levels, dangerous heart rhythms, insomnia, sleeping disorders, depression, poor circulation, and erectile dysfunction. Some older adults have a sudden drop in blood pressure when they stand up, and antihypertensive medication can make these worse. And older adults can get dizzy and sometimes get injured. Some antihypertensive medications change your electrolyte levels as you lose extra fluid in your urine. Too high or too low levels of potassium can cause dangerous heart rhythms as well. Consequences. The long-term use of antihypertensive agents causes adverse effects and tolerances. Some kinds of antihypertensive agents have an effect on the metabolic aspects, particularly like the worsening of the serum lipids and lowering of the glucose tolerance. One of the antihypertensive drugs, calcium channel blockers, also increases fracture risk, so one of the consequences can be osteoporosis as well. Antihypertensive drugs are very common, as an estimated 1 billion people in the world have high blood pressure. In the United States, about 50% of people ages 20 and older have high blood pressure and might take high blood pressure medication. The image shows how much of each drug was used in the US in 2015 and then in 2020, as well as their prices. And then these were the references I used and cited. And that concludes my presentation. Thank you.